Hello, I'm Professor Seung-June, work at Seoul National University Bundang Hospital in Seongnam, Korea.
Hello, I'm Dr. Hansol, Chief Resident and the first author of this study.
As the corresponding author of this study, I really appreciated Korea Journal of Urology editorial team for invitation to the video interview for the study, and also would like to give my thanks to Seoul Study Group, Professor Seung-June and Professor Seong. Urinary incontinence after radical prostatectomy is one of the major postoperative complications. The cause of persistent post-prostatectomy incontinence (PPI) is multifactorial, but can be a sphincteric deficiency, bladder abnormalities such as detrusor overactivity, reduced compliance, and impaired contractility.
Although the various studies reported the urodynamic findings on the bladder and urethral function following radical prostatectomy, most of them performed a urodynamic study only aimed at incontinence patients. In this study, we compared bladder and urethral functions following radical prostatectomy between men with and without urinary incontinence, using a large-scale database from Seoul Study Group. Since July 2004, we have prospectively collected data on urodynamics from 303 patients with lower urinary tract symptoms following radical prostatectomy at 3 affiliated hospitals of Seoul Study Group. After excluding 35 patients with urogenic abnormality, pelvic irradiation after surgery, or history of surgery on the lower urinary tract, 268 men were evaluated. Patients were divided into individuals with urinary incontinence and those without urinary incontinence. Variables from patient demographics, uroflowmetry, urethral pressure profilometry, and filling cystometry were collected and analyzed to identify the possible factors related with PPI. This slide shows the overall patient demographics. The mean age of 268 patients included in this analysis was 66.8 years at the surgery and 60.2 years when receiving a urodynamic study. Of all the patients, urinary incontinence was reported in 150 individuals. Patients with urinary incontinence were significantly older. However, other demographics were not different between two groups. 14 patients among the PPI group did not demonstrate urine leakage on urodynamic ALPP test. Also, 33.9% in the non-PPI group showed a positive result on the test, though they did not report the subjective symptoms on urinary incontinence. Actual value of LPP among the patients with a positive test was lower in the PPI group. Urodynamic findings are listed in this slide. Overall, reduced bladder compliance was found in 27.2% of the patients, and 31.3% had involuntary detrusor contraction. During voiding phase, 63.1% and 7.8% had detrusor underactivity and bladder obstruction by the urodynamic definition. Compared to patients of the non-PPI group, those in the PPI group had a lower maximum urethral closing pressure and lower maximum cystometric capacity. As for voiding parameters, maximum flow rate during a pressure flow study was higher, and the detrusor pressures recorded at the onset of urine flow and at maximum measured flow rate were lower in the PPI group. Concerning detrusor underactivity, instances between both groups were not different, while the occurrence of bladder obstruction was higher in the non-PPI group. In the multivariate logist regression models with variables from patient demographics, uroflowmetry, urethral pressure profilometry, and filling cystometry, only maximum urethral closing pressure and lower maximum cystometric capacity were identified as the related factors with the presence of PPI. In this study, several limitations should be considered. Retrospective design, selection bias, and heterogeneity of data due to multicenter study are all considered to interpret our findings.
Well, I should like to end by saying this. In our study, a significant number of patients with LUTs following radical prostatectomy showed a reduced blood compliance and truth overactivity. PPI is associated with both impairment of the urethral closing mechanism and bladder storage dysfunction. Both urethral and bladder factors should be considered in the evaluation and management of patients with PPI. Some efforts not to attenuate maximum urethral closing pressure, such as a precise identification of the sphincter complex and meticulous dissection to prevent tissue damage, would be beneficial to prevent the development of PPI. Thank you once again for invitation and support to our study.